Okay, Dr. Peter Martoni here. I'm sitting with a patient who is videotaping me. Thank you, patient. We're not going to use his name. Fantastic. So I want to give you 3 exercises to do. What ends up happening is when the spine ends up, when you start losing the curve in your neck, the body says, whoa, 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 well, I don't want this to be real tense all the way down to here, so we pick up a curve here. And in order to do that, the body engages these muscles called the iliopsoas. And then what happens, these psoas muscles get really, really tight and they cause chronic lower back pain. So when we start adjusting and we start improving this curve, we want to address these muscles down here. And I'm going to give you 3 exercises right now to do that. And these are going to be exercises that I give a little bit later on in the plan once we have some adjusting going on. So the first thing we want to do, and the iliopsoas is right here. The first thing we want to do, it's an exercise is on all 4s. So we're going to kind of get down on the ground like this, and we're going to take this left knee and bring it to my right shoulder, armpit. So we're going to come in, and we're going to try to bring that knee over, and then we're going to take the right knee to my left armpit, and we pull it up. We pull it up, try to get as tight to the armpit as you can. So again, if we're looking at it like this, we're going to take this leg, and we're going to come up. We're going to take this leg, and then we're going to come up. So we're going to do that. That's exercise number 1. Then the next thing you're going to do, you're going to go down to a bench, and you're going to lie on your back or the ground. You're going to take your fingers. You're going to come over an inch from your belly button, and then you're going to press down. There'll be one side you'll feel, and it won't be really that bad. You're trying to press all the way to your spine. I know it sounds uncomfortable, but it's good. And then you'll go to the other side, and then one side's going to be really, really, really tender. And it's important that you press in on that. You don't have to hold it that long. You just want to bring blood supply to that. And that will help take pressure off your lower back by going through your stomach. And then, actually, I said I'm going to give you 3 exercises. I'm actually going to give you 4. So then you want to get down. You want to do crunches. Okay? That helps the stomach. And then the last thing you want to do is you want to get this wobble board. Because as you start to lose that proprioception in your neck and your head comes forward, what you do is you lose a sense of balance. So you see people walking with their head forward and their shoulders forward. So it's very difficult when you're on a wobble board to have forward posture because you're not going to be able to balance. So when you are on a wobble board and you have to have a nice straight up posture in order to be able to balance on one of these. And this looks like it's very easy to do, right? I've been working so hard on it. And the way we talk about that is train your brain to get out of pain. You want to increase proprioceptive signals or balance signals up into the brain. Nurtures the brain, helps keep the brain healthy, and then it also helps these muscles balance more completely, and then it takes pressure off your lower back. So those are the 4 exercises I want you to do. It's going to be that exercise on the ground. Then we're going to get down, we're going to press in on those iliopsoases, we're going to do crunches, and then we're going to do some wobble board exercises. The wobble board that I like is Go Fit. So just go on Amazon, get the Go Fit wobble board. Thank you so much.